Well, I have 2 genetic mutations, one in Titan and one in myosin. An easy umbrella term for that would be Titan Myopathy. Within Titan Myopathy, there are a variety of disorders, differing in severity. I have tremors, weakness, scoliosis, cardiac involvement, and issues walking and lifting and bending and that sort of thing.
Okay. So, since that's been going on, right? Let's see, I understand you've been having some difficulty walking.
Yes.
Right? So close in on that one.
Okay, so my left foot has always kind of turned in, but now I'm even having just like trouble like lifting my leg and getting my feet kind of in sync, and I have issues with balance, and stairs are kind of difficult for me and that sort of thing. I get tired very quickly.
Understood. And what other, let's go down the other list. I believe you have also shoulder issues as well?
So this shoulder shoulder and arm have started to get pretty weak. So the pain in this shoulder has become pretty extreme, and it kind of like radiates up into my jaw. And I've had TMJ for many years, but I feel like it's kind of exacerbating that. And it just kind of makes it kind of difficult to use this arm as well.
Understood. And I believe the last part we're talking about was your neck and the hands?
Yeah, so I've been having issues, just like even like bending my hands fully back. And this hand has a lot of issues, like probably more on this side, like with gripping and that sort of thing.
Understood. All right. So here's the bottom line with that, with the Titan myopathy, right? It goes without saying, right? This is not gene therapy. Chiropractic will not change that gene whatsoever. However, the other things, like the biomechanical issues and also neuropathies, those things we're going to address. So we're going to take a look, see what's going on. What's causing to have the compromise where we have difficulty walking, the toe in, the foot in, and also your shoulders, the wrists, where you have problems extending all the way, and also the neck and the shoulder.
Wonderful.
You're in this slouch position. And I believe you mentioned to me before, this is what you find most comfortable?
Yes.
Right. And you have a lot of trouble getting in an upright position?
Yeah.
Right.
And I have trouble like sustaining it, kind of.
But you can do it, correct?
Yeah.
All right, let's do that temporarily, so I can just take a look at your nerves. So right now, this instrument over here, we're looking for any abnormal temperature. Now, when the structure gets damaged, your body uses a signal system called inflammation. It just simply tells the body, we need to repair this area. And one of the byproducts of inflammation is heat. So that's what this device picks up, abnormal heat. And we're looking for that, for any signs of inflammation. And we got a chronic one right there. Okay, you can slouch now if you want. Okay, good. This is a small chronic nerve, right? All right. Okay, so I see a lot of swelling the whole entire thing over here. Okay. How does this feel here?
Better.
What do I hear?
Also very painful. A little more.
Okay, this is very swollen over here.
Yeah.
Yeah, so let's test this. Okay, that right hip is not moving whatsoever. It's like a brick wall in there. Okay, the left one's not too much fun either. So it was okay. Okay, lumbar is okay. There's something over here. You can slouch if you want to. I know it's a little uncomfortable for you.
It's okay.
Okay, you got something right here. Jammed up here. Sit back, relax. Yeah, you have quite quite a bit of swelling here. It feels like it's chronic.
Yeah. Oh.
Okay, you feel that right there? And it feels like a muscle knot, and you have a little ball.
Yeah.
Here. That's a swell. That's that joint capsule swelling.
Oh.
Yeah, right there. That's not moving.
Yeah.
Yeah, everything else is okay. So we got 2 spots. During our test, we identified 3 key areas. The right hip, the 6 dorsal, 6 cervical. All those 3 areas are in trouble. Now, when we take a look at the Gonstead Xray Analysis approach, you see how much curvature we have in your low back?
Yeah.
We're not supposed to have this severe kind of curve over here. Right?
Okay.
It's supposed to be a little more shallow than that. Right? So when I see something that's like too much, very hyperlordotic curvature, that means just so curved so much, it tells us that it's usually either a PIEX or PIEX type of misalignment. That means the hip itself, the right hip, it went backwards and it went inwards this way.
Oh.
All right. So when we have that kind of misalignment, right?
I walk.
Exactly. So with this kind of twist,
Yeah.
right? That's what caused the sacrum over here to be very horizontal.
Oh.
Right. So when it's that severely horizontal, that's already the first type of misalignment that's sticking out in my mind. And it's okay, then we just got to confirm that on you, man. Yeah. You definitely have that misalignment. You definitely have the swelling right there. It was tender, it was stuck, fixated, and not moving that direction either. So the PIEX, that's the one we need to correct.
Okay.
Now, next component is this. Because you have that Titan Myopathy, it's not too much different from EDS. Okay, that's I'm trying to pronounce it again. It's like a tongue twister, right? Was it the Ehlers-Danlos syndrome, right? That particular genetic problem is where the ligaments are way too loose. It's kind of similar to yours, except yours have more leeway to it. So in other words, I don't have to worry too much as if I'm adjusting a infant, like a newborn, okay? Because with EDS patients, yes, I do adjust them here. I'm just very, very gentle and very, very precise.
Right.
Because there's not much leeway. It doesn't take much to dislocate their bones.
Yeah.
So that's why I would adjust them with the same amount of force like an infant. Very, very gentle. In your case, I'll probably adjust more closer to like either like a junior high school, middle school, you know, kind of a pediatric patient. So we're still going to give like the half amount of force of an adult.
Okay.
All right. So just in case, so we don't overstretch the ligaments and the tendons and the muscles as well.
Yeah,
right?
that's my fear. So
Right.
cool.
Good. And the next component, in terms of the shoulders. All right, I'm going to take a look at this because right now, when I see you on the left one, you're really hunched up like this. So 6 dorsal over there. I'm going to realign that very gently. But on top of that, you also have this implant, this defibrillator you got going on here as well. Right? You have to keep in mind, this implant, we can see the wire lead goes into your heart. And this is your heart, actually. Right? So it goes right into there. Now, bear in mind, right, the nerves, it goes from the brain into the heart, but people also forget, no, the heart also needs to tell the brain what it's doing. So that information goes straight back into the brain. And it's this region over here that's also responsible. There's actually 2 major areas. It's the cervicals and the mid-dorsals that deals with communication with the heart. But in this area over here, that's what I noticed with those who have pacemakers or a defibrillator implant as well. The actual charge, what it does is it causes a little feedback back to the spinal cord itself. So it may cause this area over here to be extra aggravated.
Interesting.
And it may possibly cause a biomechanical disturbance to the left scapula and therefore into the femorohumeral joint and AC as well. I'm going to take a closer look with another test as well and see if that really is the case.
Okay.
All right. And the last part is the 6 cervical. I do see this disc is enlarged. See that one over here? That's normal. This one over here, that's pretty big.
Yeah.
Big, big, big. And it's starting to calm down a bit. Right? So that tells us, no, that fellow right there, that's 6 cervical, that's the one that's in trouble. And on top of that, we also see over there, that little space, that's where the nerves got come out of, and it's a little collapsed. So therefore, all that swelling, we confirm that on you, there's quite a bit of swelling over here.
Yeah.
You could pinch those nerves, and that particular nerves, it falls all straight down our elbows, forearms, the wrists, and more important in your case, since you're telling us like this way, right? Usually that 6 cervical nerve will go down to this, to the index finger
So would that be
itself.
why my fingers are like curved now? My pointer fingers?
Possibly, yes. Possible. I'm not
That's new.
guaranteeing it. Right.
Yeah, I'm just curious.
Right.
Yeah.
But it can go over here as well,
Mm-hmm.
and also innervates also partly the wrist, and that lunate as well, right? Because usually that deals with fixates like this is either the posterior distal radius or the lunate bone is something one posterior.
Okay.
That means because this little bone over here is this bone over here. It can
Okay.
either go forward or backwards.
Mm-hmm.
So when it goes backwards, then it gets jammed upwards like this, and then it says can't lift it up. If it was jammed down that way, then it says, oh, okay, we could easily do this, but when we try to go this way, flex it, it will get jammed,
I see.
it will move. So we're gonna confirm that on you as well. So you mentioned before that the most difficulty you have walking, and that's why you need your cane again,
Mhm.
is your left foot.
Yes.
So this is what I see on the X-ray. You got two misalignments, two big ones that's glaring out.
Mm-hmm.
This talus over here. I want to see this lining up with here,
Oh, wow.
but it's sticking up. It went this way. This calcaneus, the heel bone, from here, should line up with here.
Okay.
So it went quite up a bit. So it's this bone over here. That's what we're looking at. See, it's supposed to line up here. It's supposed to
Right.
be nice and flush, but no, it went upwards.
Oh, now I get it. Okay,
Yeah.
wow. Yeah.
Exactly. So it's supposed to be flush with this bone over here, but it's not. It went upwards. And so that's not happening. Same thing with this talus over here. It's supposed to be flush, but it's not.
No.
Okay. And then the next one, you can see this heel bone went even further upwards compared to the other one.
Yeah.
So, yeah, here should be here. And it's significant enough. You can see this wide gap open right over here in that joint space. So there's no big surprise. That one may not be so happy right there. So, yeah, this is both of them. We gotta take a look on you and see what we need to correct, right?
Sounds good.
That's right. So now what we're gonna do next is lock and roll. Okay, I'm gonna be very gentle with this one. That's all it takes. Walk around.
That's it?
I did say we're gonna be very gentle with this one.
Alright.
Give it a walk.
Feels a little looser on this side.
Mm-hmm.
That's weird. Yeah.
How's your
Like-
overall walking? Give that a try.
I feel like this leg feels a little steadier, actually. But yeah. Kind of feels looser. I don't know if I'm explaining that right. Like it has more air or something.
Okay, that's a good start.
But it's a good feeling.
How's the left?
The left still feels, I don't know. I guess it feels the same, yeah. Yeah.
Try to walk a little more.
Well, actually, I feel like when I got here earlier today, my foot was a lot lower when I was walking, and now it feels like I can kind of pick it up for the first time in a while.
Good.
I mean, it's still not quite steady, but
Yeah, I see that with your foot. You have a significant toe in, so I'm gonna take a look what's going on with the foot itself as well.
you know.
All right. Okay. Let's go ahead and address everything else so we can.
Actually, even just like standing upright isn't as hard for my lower back now. Yeah.
So you don't have to slouch as much?
Well, no, I mean, my shoulders still bother me, but I mean, like, the part where, like, I felt pressure on my lower back almost, like, when I tried to sit upright, like, I don't feel that right now.
Excellent.
That's actually really weird. I don't remember the last time I didn't feel that.
Okay, let's get on to the next part. Okay, 6. Yeah, right here. Okay, relax this over here. Don't let it drop. Oh, there we go. Right. Look. There it is. Now let's get your 6 cervical. Let it drop. Let it drop. Relax your shoulders. Let them drop. Just got to get that. There we go. All right. Good. Check your shoulder.
Oh.
Nope. This is the misalignment right here. Okay, there we go. It's already loosening up. So we don't need to set this.
Okay.
Good. Coming up. All right. Walk around, please.
Wow. Oh. I just.
Yeah, don't go too crazy on that. We just set that 6 cervical over there.
It's just weird. Yeah. Oh wow. I don't feel like I want to cut off my arm right now. It does feel so much looser. Wow.
That's what we mentioned before. We have to restore that nerve function from here to get to the shoulder.
Yeah. Because I haven't really been able to even really roll this back in a really long time.
Good progress.
Yeah.
Okay, show me what you can do with your wrist. No, this is still stuck. See? Yeah, see, that's still stuck. All right. Let's see what's going on. Not too bad. This cleared up already. Actually.
Yeah.
Mm-hmm.
It's not clicking as much.
Mm-hmm. That's why it's so important to ensure that you have proper nerve function in there. No, not too bad. Not bad at all. Oh, okay, we got something here. Yeah, this is your lunate. We just gotta set it. There it goes.
Wow.
Okay, give that a roll.
Oh my god. Yeah. They're actually equal or near equal, much more equal than they were when I walked in. Wow.
Mm-hmm.
I haven't been able to move my left wrist like that in 2 months.
Nice.
That's awesome. All right.
Not done yet.
No, I'm just.
On your back.
I'm sure you hear this all the time, but to feel that big of a difference is exciting.
Certainly is it?
Yeah.
Work on your feet.
Okay.
On your back.
Getting a little teary-eyed.
Let's scoot you a little up.
Okay.
Okay, this is the one with right, we're gonna be very gentle with this one. This is the one with the calcaneus. Yep.
So would that be why my ankles always clicked?
Oh, you betcha.
Hmm.
Okay, let's see what we can see what we can do without actually trying to rustle this thing. Pump it up first.
Mm-hmm.
Hey, how do you like that? Feel that right now?
Yeah.
Yeah, it's moving. That's good. Hey, this was also moving too. But the talus is stuck. Okay, we're gonna get that talus moving again. Okay. Go. No. Okay, we're gonna go a little more. Almost forward. There it is. Okay, walk around.
Wow. That's really weird. This foot really, much different. I feel like this foot's gonna need a little time, but even still, I feel like my foot's flatter than it's been for a while because I feel like I've been kind of rolling out.
Mm-hmm.
And I actually feel like.
Actually, let me take a look over here. Keep walking. No, not enough. Okay. Right over here.
Okay.
No, your calcaneus is still stuck, actually. It's kind of hard to tell because you had that little ligament flexibility.
Mm-hmm. Well, this foot also I can fully turn in, which is gonna kind of screw you up.
No. I don't mind that because again, it just looks like you had an old spring. But see, this is jammed up. So we're gonna put this up once more again. See see if we need to fix this. Okay, we're getting there. Good.
Well, I definitely feel like almost like circulation in my shin coming from my foot now, which is a weird feeling, like a good feeling. It's a nice relief feeling, but just from me manipulating.
A little more. Yes. Okay, walk around. See, all right.
Kidding me. I don't remember the last time I walked like that. It's been at least like 6 months. Yeah, actually, yeah. It's good. Sorry.
That's okay. That's okay.
Happy tears though.
All right. So, how's it now?
Great. I mean, obviously it's, still weak, but it feels more stable. Like I feel like, again, like I was constantly kind of teetering on, the edge of my foot. But now it feels like I can actually like apply pressure to the balls of my feet again, which is nice because I feel a lot more stable. Even like walking upright.
Actually, no. We still need more work. Just one more vector. I gotta get one more.
I mean, I'm happy.
Okay, go face down. Face down, please. Okay, slide down a bit. Yeah. Don't worry, we're gonna go a little more very gentle with this one. That was it. Coming up. Good.
Yeah.
So what's different about this time?
My foot is straight.
Mm-hmm.
And it like actually walks. I'm actually walking heel to toe right now.
From heel to toe off, huh?
Well, now I wonder. I'm curious. No. Okay.
Oh, let's not push it too far.
I was excited. I wanted to see.
No, we still need more nerve function down to the heels because keep in mind, here's another little tidbit for the young guys and docs and students. When we have a severe EX misalignment, which you have, that means your hip went turned all this way. The problem is this: your body, we can't walk this way.
No.
You know what I'm saying?
Yeah.
So our head has to go this way. So our body has a counter twist. So in essence, your body just basically just did that. It's just a very severe type of twist. Because the head, it just can't follow along with the rest of it. No, it has to even though you're supposed to face this way, and even though your hips twisted this way, no, the rest of your body got to compensate.
Yeah.
So that's why it just did a very severe type of twist all the way down the bottom. And pinching off all those nerve functions straight down to the ankles right there. So that's why it's still a little challenging onto your left side over there.
Yeah.
Just some more time for the nerves to regenerate, get it down there. But at the same token, I do recommend, let's do calf stretches. So then
Calf
we go,
stretches?
right. So go onto the staircase, hold on to both rails, and you could do like heel dips.
Okay.
All right? Because we want to wake up the Achilles. Right? There's a lot of sensors nerve sensors, simply put, right? In that Achilles, we need to wake it up. Right? So get it working again. And then you also start to feel a lot more stable and you won't have to tremble as much into your legs.
Yeah.
Right? Okay, next component. That's all right, we're not done yet.
Let's keep going.
Have a seat, please. Okay, let's check. How is this shoulder? Because this has been jammed up for way too long. Okay, this is working. SC is jammed. So that's an interesting one. You would figure that the AC or the glenohumeral or scap. Actually, we did correct your scapula, the shoulder blade, but no, the collarbone right here.
Oh yeah, that really hurt.
This one, right, it's jammed. So we need to fix it. I'm gonna be very gentle with it. Good.
Oh my god. I don't remember the last time I was able to do this without being in excruciating pain. It's been months.
Give me a little gentle nudge. So,
Oh.
hear that little clicking, right? Yeah. That's all it took. Okay, walk around. Sounds like it. You okay there?
Like I'm in the right place if I did fall.
Yeah. Okay.
Test that shoulder. How do you like it?
I mean, when I say probably, like, it's been since June that I could even, like, do this without being, struck with pain. This is amazing. Even, like, driving, like, even just a slight lift of my arm was painful. And, like, I feel like I could drive with this arm right now. Or, sit at my desk and not have to put my arm in my lap or...
Nice.
Wow. Yeah. Yeah. Wow, yeah. Feels good. Yeah.
Can you actually extend the arms one more time? I remember during the consultation you had a lot of trembling off the back. The trembling is
lot more.
not existing on the left side.
It's not as much, no. So the funny thing is, the weak side is this side. The tremor side is this side. So like it's like this side, the tremor's worse, this side's the weakness is worse, but it's still a lot less on both sides, really, because usually by now I'm like full on. And
Got it.
actually this is quite steady for me. Yeah. Wow. Yeah. Cool.
Yeah.
All right.
Okay, so here's your homework.
Homework.
You just need to ice here.
Ice here.
Right, your low back, right, especially this right hip joint over itself.
Okay.
The right sacroiliac joint. Because that's your foundation. That's what causes you all twisted up like this. And then you just simply just went all straight up to your shoulder and the neck and start pinching all nerves all over the place. It just didn't make anything but a lot more fun in that case. So I said, calm it down. I just want to let you know, for the average person who didn't have the Titan syndrome, I usually see like 2 or 3 more corrections for that hip. I don't know what it's going to be in your case, because yours joint probably going to be a little more looser than the average person. You may need a little more, don't know.
Okay.
And I do recommend lower core strengthening. I know it's a little bit more challenging for you in your case, but I still recommend let's do a little more lower core strengthening to retrain and rebuild all those muscles that's weak and ligaments, tendons, so on and so forth.
Okay.
So we keep that in place. So it keeps you out of trouble as well.
Well, that's what I was gonna ask.
Yeah.
Like, would strengthening help to try to like keep it better aligned overall?
Actually, I would try to recommend, it's maybe a little tough in your case, but leg raises is actually a more ideal thing. So since suspended leg raises may be a little too tough for you, I would recommend, lay down on a flat surface, which you find more comfortable, and just gently raise both legs up,
Okay.
up and down, right? And that'll strengthen up the lower core. You
Absolutely.
can start from there. Okay, last fun part. Okay, open mouth. Close. Open. Yeah, that's one heck of a clunk you got in. So we're gonna start on the good side first. Open your mouth. Close. Close. No, open. Slowly close. Open. Close. Open. Close. Good. Close. Open. Close. Open. Close. A little more. Close. Open. Close. Open. Close. Open. Close. Okay, we're gonna get to the next level. Stand up for me, please. Open. Close. Open. Close. Slowly close. There it is. Open. Close. No, too fast. Open. Close. There it is. Open. Close. Open. Close. There it goes. Now it's tracking it better.
Yeah? Yeah? Cool. Very cool. Thank you so much.
Oh, you're very welcome.
This is great. I walked in here in a lot of pain, and I actually, wow, this collarbone, I didn't realize that the collarbone was that big of a problem, but I think that was what that pain was.
Mm-hmm. Well, it's a little combination of everything. That sixth cervical nerve is just so badly pinched off because your whole entire body is twisted up, so it shut down, nerve function to the scapula. That's where the scapula went out. The humeral joint went out, the clavicle right over here, and the inside that went out. So it's just a domino effect.
Yeah.
Right from there.
Well, thank you so much.
Oh, you're very welcome.
All right.